Doing great. How are you?
I'm doing well. Good to see you. It's been quite a few years that I've managed your hormone program, but it's just in this recent span of the last 3 months that we took care of your shoulder using stem cells. Why don't you tell me a little bit about kind of your experience with Thrive MD coming up into that procedure, and then we can talk a little bit about the stem cell procedure.
Yeah, great. Happy to. I started with Thrive MD on the hormones years and years ago. And what was interesting was when I met Dr. Brandt, it was on a totally different level of business. And we started talking about some of the things I tried and was doing. And he said, well, he goes, sounds like you're kind of doing some things right. And but I'm sure I can tweak you and make things a little better. And so I liked what I was hearing. So started using Thrive MD, I don't know, 6 years ago, maybe 7 years ago, quite some time ago. And immediately the tweaking, to use his word, had a huge impact on overall energy levels. I dropped some body fat and just kind of leaned out and have maintained those levels ever since I started with Thrive.
And then how recent you ran into problems with your right shoulder, and you came to me, sent me some MRIs to review, to consider treating your right shoulder and your right elbow.
Yeah, college athlete, played college baseball, and I laugh and tell people I think I maybe messed my shoulder and elbow up more coaching my boys throwing, without warming up properly than I did in college, but had significant deterioration around the AC and then around the, what is it, Scott?
The humeral joint.
Yeah, a lot of inflammation, a lot of arthritis. And I went and saw a orthopedic surgeon, and he said, Todd, you need a total shoulder, you're bone on bone. I was unable to, really do the exercise I was used to doing. But most importantly, I couldn't sleep through the night without waking up with my shoulder frozen and just really killing me. So it drove me to see this orthopedic surgeon, and he said, yeah, you're a total shoulder candidate. The problem is, as active as you are, you're going to wear through that total shoulder, by the time you're 61. And I'm 51, I'll be 52 in September. And he said, then we'll have to do a reverse shoulder, and you'll lose a lot of your mobility. So I knew Scott did, and Thrive MD had done, stem cells. So I called up Thrive and asked Dr. Brandt if he thought I was a candidate, and he said, let me see some MRIs. And fast forward, I've had 2 rounds of injections, and I'm asymptomatic. I was telling you earlier, no pains with the light recovery workout that I've started. Definitely no pain in the elbow or shoulder that keeps me up at night. So to me, I wish I'd known about stem cell 5 years ago instead of waiting as long as I did.
When you first called me, you said it finally kind of hit that breaking point, that your, the tennis elbow fraction as well as the shoulder were just keeping you from doing everything you wanted to do.
Basically allowed me to be as active as I was prior to it just, degenerating so bad to the point where I couldn't do the things I wanted to do. And the stem cell in literally probably a 6 to 8 week period is almost putting me back to like I was, prior to the degeneration happening so quickly in my shoulder. I wish I'd done it sooner.
And as far as your experience working with Thrive MD, the clinic and the calls and the follow-ups, did everything go smoothly for you?
The ladies in Thrive MD lined everything up. I'm not from Denver, so I flew into Denver. Everything was lined up to a T. Basically, all I had to do was show up. And we did another round of MRIs while I was in Denver. Their office lined that up. So it was seamless for us. It was just, plug and play. The post-care was great. I had, staff calling the next day asking how we were recovering. We had staff actually calling that afternoon. There's been nothing negative about the entire experience.
That's great. And as far as the procedure, you were comfortable throughout the injection procedure and the harvest procedure?
Yeah, the recovery is probably the most impressive thing to me about stem cell is, I had the stem cell done, I think on a Wednesday. I flew back on a Thursday, and literally by Friday, I was back in the office at 7:30. I was, kind of in a sling, trying to keep it, a little bit immobile. But by Monday, felt nothing from the procedure. As opposed to had I had a total shoulder, I would have probably had a 6-month to 12-month recovery. This was literally a 48-hour recovery.
Well, that's great. I really appreciate you sharing that. People love to hear from real patients as to what this experience, entails. And that pretty much sums it up. I appreciate you doing it.
Yeah, happy to do it. And I'm as real a patient as you could ever find. and thrilled to know that, if something else starts hurting, I've got access to Thrive MD.
That's awesome. Well, thanks so much, Todd. I appreciate it.
I appreciate you and Thrive, what y'all do.